Hi, my name is Sydney Calhoun. This is my medication administration video for insulin. This is my badge. And then 360. All right, I am in the medication room of my facility. I am following my facility's no distraction policies. I am keeping my conversations with my fellow nurses at a minimum. I am not using my phone. The doors are shut. The first thing I'm going to do is I'm going to compare my MAR to my patient order form. Patient order form. And I'm going to perform the 7 rights of medication. The first one is the right patient. So Jaguar Jones, Jaguar Jones. Date of birth 8/25/1963. Date of birth 8/25/1963. MR number is 4176352. MR number is 4176352. Allergies are penicillin. Allergies penicillin. Now right drug, Novolin R, regular insulin, Novolin R, regular insulin. Right dose, U100 insulin 10 units, U100 insulin 10 units. Right route, subcutaneously, right time, 30 minutes before meals, and right intention would be for control of diabetes. Now I'm going to put my patient care order form away and leave this, and then I'm going to perform hand hygiene. So Novolin R regular insulin, U100 insulin, I'm going to grab that. Which is right here. So Novolin R regular insulin U100, Novolin R regular insulin U100. Expiration date is 12/1/2025, 0800. All right. Now I need 10 units subcutaneously. So I have my my 1/2 milliliter insulin safety syringe with a 29 gauge 1/2 inch long needle. All right. So the first thing I'm going to do is take my alcohol pad, clean the top, dispose of it, take my insulin needle, take it out, do 10 units of air. All right. Put it in my palm, put it in the 10 units, flip it over. And bump out whatever I need. The bubbles. All right. I'm gonna a little bit more than that. Now do. All right. Now I'm gonna go over. All right. I've done 10 units of insulin, and then I would have my fellow nurse double check that I grabbed 10 units of insulin. And then I'm going to make my tag label for my insulin, which is going to have the drug, the dose, and the name of my patient. And now I'm going to do that to the MAR. Novolin R regular insulin, U100 insulin. Novolin R regular insulin, U100 insulin. 10 units, Jaguar Jones. Jaguar Jones, subcutaneously 30 minutes before meals for control of diabetes. Novolin R regular insulin, U100 insulin. Novolin R regular insulin, U100. Expiration date 12/1/2025 at 0800. And then Novolin R regular insulin, U100 insulin. Novolin R regular insulin, U100 insulin. Subcutaneously 30 minutes before meals. So now I'm ready to go to my patient. Knock, knock, knock. Hi, Mr. Jones. My name is Sydney Calhoun. I'm here to administer your insulin injection 30 minutes before you have to eat. But first I'm going to check to see you are who you say you are. So, Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963. MR number is 4176352, MR number is 4176352. Allergies is penicillin. Mr. Jones, I see that you have, that you're allergic to penicillin. Is there any other allergies you would like to tell me about today? No? Okay, Mr. Jones, I am going to take your blood sugar level before I administer you anything, just to make sure you're in the safe range. Good, you're in the safe range. You're not too low. Okay, so I'm gonna let you know what I'm gonna do. I'm gonna raise you up to a comfortable height. I'm gonna put down the rail. I'm gonna expose your abdomen. And I am going to administer the needle 2 inches away from the umbilicus, not above the intercostal space and not below the pubis space. And I'm gonna make sure that that there's no bruises or anything. So I'm gonna raise you up. Are you cool with that? Do you have any questions about your medicine or anything before I start? Okay, so I'm gonna raise you up. I'm gonna perform hand hygiene. And I'm going to check my MAR again. So, Novolin R regular insulin U100, Novolin R regular insulin U100. 10 units, subcutaneously 30 minutes before meals for the control of diabetes. Jaguar Jones. And then Novolin R regular insulin U100, Novolin R regular insulin U100. Expiration date is 12/1/2025, 0800. Novolin R regular insulin U100, Novolin R regular insulin U100. 10 units subcutaneously 30 minutes before meals. All right. And hygiene. I'm going to get my gloves. Try not to struggle them on. There we go. And my goggles. I'm going to drop down the rail. I'm going to take my alcohol swab and clean. Put that right there. All right, if I can pinch 2 inches, I'm going to come in at a 90-degree angle. If I can only pinch 1, I'm going to come in at a 45-degree angle. And I'm making sure that there's no blood, no bruises or anything before I administer. All right, I'm gonna take my needle, put down the safety, pinch, do like a dart, go, slowly do the needle, wait a couple seconds, then pull up. I am going to do this. Dispose of it properly. Put my patient down back to the lowest height. First, I'm going to put pressure. Now, I'm going to put him down to a comfortable height. Put the rail back up. Get him comfortable. And I am going to take my gloves off. Perform hand hygiene. I'm going to make sure my patient. I'm going to keep an eye on my patient, make sure he doesn't have any allergies or adverse reactions. I'm going to document the date and time and drug and route of the medicine that I just administered. And then I'm going to sign my initials by it. And then I'm going to come back in 30 minutes to check on my patient and make sure everything's good. Thank you.